Hello, I'm Margo Pumar. I'm Associate Medical Director for Integration and Collaborative Care and a psychiatrist for the Department of Psychiatry. Welcome to today's video, a video short, which is to provide supports for our people. Today, we are looking at supporting our healthcare teams during the COVID-19 pandemic. Right now, it's important to remember where we are in this pandemic. We're at the beginning. We're sort of in this pre-disaster, beginning to feel some impact, developing some heroic actions to prepare us for what will really happen. But we really haven't felt the full force of this. But we're already working pretty hard and starting to feel some fatigue. So it's important just to keep this in mind for today's video and as we move through future video series. Right now, a lot of things are coming our way. We have a virus that is swiftly moving around the globe and right now seems smarter than us. We are bombarded by all sorts of information as we worry about the spread, the risk of illness, experience loss, and have constant news about supply shortages and PPE and swabs and whether we can come to work or leave the house or go to a restaurant. And the change that we're experiencing is rapid, dramatic, and frequent. There's not enough supplies, time, or anything, and we're all moving pretty fast. And we have a lot of things coming ahead of us: ethical dilemmas, more intensity, more concerns about financial burdens. All of this is happening while many of us are isolated from those that we love the most, and we're not sure when we're going to see them again. And with that comes a great amount of emotional and interpersonal feelings. So many, in fact. They're bubbling off this page. Uncertainty is obviously the biggest one. So much worry. We don't really know what this is like. As someone said to me earlier today, have you lived through a pandemic before? Well, we haven't. A lot of us have some baseline depression or anxiety, and it's all getting exacerbated. We're starting to experience conflicts with our coworkers because there's so much stress, and there's just a lot of sadness and frustration. It's a lot for us to handle all at once while we're trying to work these really intense jobs. I hear a lot of people saying, it's not a sprint, it's a marathon. I can't run marathons, and many of us can't. And many of us, if we think about that initial picture and our lives, it's going to be hard to run a marathon for months and months and months of our foreseeable future. So we need a new framework. It's a little bit like trying to be on a tricycle and take a rocket to the moon. So I think trying to remember some practical tips as healthcare providers and staff will be really helpful. Our work is more intense, so we need to take more breaks. Walk outside, take a breath, have a moment to do a meditation. And being in the healthcare field, we often are constantly looking at our patients and what they need. But now more than ever before, we need to put on our own oxygen mask first, which means we need to have good boundaries. So a couple of tips. If your patient is asking you for something and you think to yourself, could I do this thing for all my patients? And the answer is no, then probably you might need to answer something like, this is not something that's in my clinical practice right now. Or if you think I'm asked to do something, how is this going to impact my family or my ability to care for myself during my own time to recover from my day? And if the answer is it's going to have a big impact, again, you might just want to say, I'm sorry, I can't do that right now. And finally, it's really important to not compare yourself to others. We all do this, but right now it's important to remember that we all handle this differently. Some of us are affected by all sorts of different things in different ways. So don't compare yourself. You're awesome. Other ways to think about managing this new, very intense normal is to think about Maslow's hierarchy of needs. A lot of us have seen this already. So in terms of our basic physiological needs, we need to think about shifting and changing our routines to set up the new pace that we're going to live. In terms of our safety and protection and security, it's important to just remember all the ways that we need to stay safe. And one of it is to stay emotionally safe. I've heard a lot of people say to me recently, I stopped looking at the news and I feel so much better. So instead of reading the news or other kind of social media sites, maybe just visit the CDC every few days or another trusted website. We're still social beings and we need to connect. A lot of us have been learning about Zoom and other types of ways to connect. And what we're finding is that there are ways to connect virtually that still are authentic and vulnerable and meaningful. And I encourage you to press into those things. In terms of managing our own selves, I think having a go-to app is really helpful. There's just moments in the day where it feels like it's too much and we need a quick new habit to try. I'll have some tips on the next page. And finally, if you're starting to feel like, all right, I've caught my breath, I've got this, that's a good time to think about reaching out to others. Maybe there was that older person in your neighborhood and you're not sure if anyone's checked in on them or they've got groceries. Go ahead and give them a call. So, what app do you use? Right now, for healthcare providers during 2020 in the COVID pandemic, Headspace is offering a free premium subscription. For UCSF employees, Daylight and Sleepio are also options. And then if you've constantly struggled with sleep, it's probably getting worse. And CBTI is a wonderful evidence-based way to start working on your sleep habits. And then an easy way of just adding moments of meditation into your life would be to use an app like Calm. So there are going to be times where you need a little bit more, where it's just gotten to be too much. And I think that's okay to say. Maybe think about now who you might be able to say that to or feel comfortable reaching out to. And then here are some good suggestions for ways of getting more help. So reaching out to your PCP with a virtual visit. You guys in primary care are actually really good at this. So I would use that as a resource. Also, there's all sorts of teletherapy happening right now. Everybody is still providing therapy, but just via Zoom or some other app like that. So Talkspace is a good example of that. Caring for the Caregiver is a wonderful, well-established program that is also trying to respond to the COVID pandemic. And then there's the Faculty and Staff Assistant Program, Spiritual Care Services, and then there's a number of county and nationwide organizations which can be really helpful. Additionally, I wanted to let you know that the Department of Psychiatry has a fantastic webpage linked to the coronavirus and has wonderful resources for you. Finally, I just want to say thank you very much for everything that you guys do.